ANG stands for Advice and Guidance. This is an electronic system that allows GPs in primary care to ask clinical questions of us consultants in secondary care without the need for patients to attend for an outpatient appointment.
All our Cambridgeshire and Peterborough GP practices, which contains 103 GP practices, use advice and guidance. It's part of our demand management programme. However, the most important aspect of it is ensuring that we get the patient to the right place at the right time.
So the advice and guidance is a way we can actually type in the questions we want and ask a secondary care consultant, could we do this? Could you suggest something? Or would you like to see this patient instead? Therefore, we would get a reply back actually as soon as sometimes 24 to 48 hours, which in my opinion and most GPs' opinion is fantastic, because a patient before waited weeks to get that answer, now they can have that in 48 hours. So advice and guidance, in reality, we can use it in any situation. I think that's the point I want to get across. But obviously, it makes sense to use it in the specialities that the waiting list for a referral are much, much longer. So for example, the obvious ones would be cardiology, things like neurology, dermatology. They essentially have very, very long waiting lists, and also they're very, very good at giving us information so that we can cope and manage the patients ourselves, because it's advantageous to the patient, to us, and also to the secondary care because of the pressure that they have.
Some of the patient benefits is to ensure that the patient's referral is not rejected, with the clinician reviewing that ANG advice and guidance and then being able to direct it to the most appropriate clinic.
ANG is definitely worth using. It's very quick, it's responsive, and I can't see a single reason why any one of us GPs wouldn't want to use it for patients. At the end of the day, it takes weeks sometimes for a patient to be seen in a clinic. This is basically a digital way of getting the answer back, a digital way of getting advice, and digital way of getting a confirmation that we are doing the right thing. And as for the cost of things, instead of a proper referral through the digital system, advice and guidance is a fraction of the cost. So you are essentially getting that reassurance or the advice or the final treatment at the fraction of the cost.
There are a number of benefits of ANG for both primary and secondary care. We're all working in an environment now where there's a lot of pressure on outpatient appointments, and anything we can do to relieve some of that pressure is for the good of the NHS and for patient care. So by having an advice and guidance request, quite often that avoids the need for the patient to be seen in clinic, or certainly at that point, and that's clearly to the benefit of the greater NHS system. From a GP point of view, they can have a quite speedy response to a clinical question. We aim to turn around our ANG here within 48 hours. And again, if there's a two-way conversation, usually those are completed within a few days.
I would certainly promote the usage of advice and guidance across all our providers and GP practices. This will help capacity going forward because we have some severe pressures on our NHS. It will also ensure there's a better outcome for our patients, ensuring we get the patient into the right place, the right specialty at the right time.
In my opinion, all practices should engage in advice and guidance. It's a brilliant service, it's timely, it's auditable, it's two-way now, which makes it even better. It gets the patient on the correct pathway, stops them at the appropriate place, or they continue on and have an appointment if the consultant feels it's necessary. Obviously there are cases where it's clear-cut, the patient needs to be seen, we don't need to do the advice and guidance, but if the GP has any concerns at all that's clarified, the patient's in the right place at the right time, and quite frankly it's very easy to use, very easy to monitor, and really I couldn't imagine my working life without advice and guidance and e-referrals in this day and age.